All right, labral tears at the shoulder. Labrum. What I want you to focus on is if you ever golf or if you know of golf, if you look at a golf ball and how it sits on a tee. So that tee is really small and the ball is a lot larger, but that ball is able to stay on that tee because there's a lip on the tee. That little lip or that little ring holds that ball on there. That's the same thing that happens at, or that is present at the shoulder. So the labrum is a ring of cartilage around the socket. So if we look at the ball and socket joint, you have your ball and your socket is actually not this large. It's kind of like this. And then you have a ring of cartilage that goes around it, and that's responsible for keeping the ball pretty steady right on top or right on the side of your shoulder. There's many different injuries that you can have at the labrum. It can be damaged from a dislocation, when the ball comes out of the socket and it can smash back in. It can take off a chunk of the labrum that way. It can be torn from repetitive overuse, as in throwing. A lot of baseball pitchers, I think like 90% of baseball pitchers, at least in the professionals, has some sort of tearing of their labrum, but it doesn't really cause them pain. So the ones that cause pain in the shoulder are if you experience like a pain or like a click when you try to lift your arm and you try to like avoid it, and then you can get your arm up like that. It's usually super painful to try to lift out to the side. You can usually come up towards the front, but out to the side is not good. But if you're experiencing a painful click in the shoulder, that's a pretty dead giveaway that you have a labral tear. But it should be correctly diagnosed and treated appropriately. Conservative treatment can work. It can surely work, and depending on the extent of the lesion of the tear, it may need to be surgically reconstructed.